Hello, and welcome back to the next episode of this Healthy Life podcast. I'm very excited for my guest today. She's a dear friend, an amazing doctor, helping so many people with Lyme, mold, environmental illness, and so many more things. So Ashley is an expert in acupuncture and Chinese medicine. She also is an expert in cellular detox, epigenetics, and functional medicine. And she's dedicated her career to helping others that are on their path to healing and addressing the root cause of symptoms and helping people heal from chronic conditions. So welcome, Ashley. So happy to have you here today.
I'm happy to be here.
Awesome. Well, I'd love for you to start with a little bit of you sharing an introduction about yourself, sharing some of your background. So you started off in traditional Chinese medicine, acupuncture, and kind of shifted more towards chronic illness. If you could share a little bit about your journey and what led you to this type of healing work.
Sure. So I guess I'd say that maybe even since I was a little kid, or at least in high school, I was more sensitive to things, right? Perfumes, chemicals, things like that. I would get headaches. But then, and I think it was around 2006, one day I woke up and it was extremely painful to hold a cell phone or to walk, right? So I thought, this will be, something interesting. My doctor will just know what's going on, no problem, right? I was in grad school for acupuncture, but again, I was kind of brand new. So my doctor, who's lovely, but she just said, well, you probably have some sort of autoimmune issue that will take about 10 years to show up on labs, and there's really nothing you can do. And I said, well, do you think maybe it's like gluten or dairy or anything I'm eating? And she said, definitely not. That would not give you joint pain and migraines, right? So basically I just had to, like most people do, take things into my own hands and just try to figure things out. And they were basically Band-Aids though, right? So I did remove gluten and dairy and sugar, which helped tremendously. But it wasn't only until a few years ago when I was living in a house with mold that I didn't know that I ran some Lyme tests and co-infections and found out that I had a whole bunch of Lyme and co-infections and a ton of mold, right? So again, I'd probably had the Lyme for 15 years, but it just was exacerbated by the gluten and dairy and things that caused inflammation. So I learned a lot and it transformed my whole practice. But again, I've always been very interested in different chemicals and toxins and how they can affect our system.
Absolutely. And so if you can share a little bit about, at this point, you're kind of specialized in mold and Lyme, I feel like, especially with your own personal journey and just everything you've learned along the way. What are some common mold symptoms that people can look out for if they think that they might be dealing with mold toxicity?
Sure. So the ones that people think about, right, are respiratory, like asthma or maybe eczema, skin issues. And a lot of people don't really put together brain fog, fatigue, joint pain. There are a whole bunch of symptoms that people have. And unfortunately, they overlap with a lot of other different pathogens or viruses and things. And so it can be very tricky to differentiate what's going on. And as we know now, a lot of people have multiple things going on, right? I don't ever have a client that just has one bacteria or one virus or one ailment, right? We have many layers. And so
yeah, absolutely. And as you kind of like work on one, another one might come up or start testing positive or showing up that you didn't really have kind of access to almost before too, right?
Yes. And one thing that is great, I would say, is that testing is much better now, right? So even though it can be expensive on the front end, it can save you a whole lot of time. And again, actually expense of just looking for these different things because everyone has a lot of layers and we need help discovering what those are in order to find your root causes.
Yep, absolutely. And that's a great question. That's actually something I had on my list here to talk to you about too, is I want to kind of deep dive into the different testing. So, we can start with mold testing. So there's mycotoxin test. That's like a urine test. That is what's mycotoxins are being stored in your body or total toxins. And then we have the oat test. And then we have testing your home as well. So I'd love to kind of spend some time and break down each of those tests. Maybe we can start with the home testing, what you recommend for finding mold in your home. And then we can kind of start to chip away at the other two.
Sure. So finding mold in your home is probably the most difficult, right? I wish there was one test we could do, but there isn't. So I have a kind of like a roadmap of what I tell people to do and start with. And you will have information on each of these types of tests on why it is A good option, why it is not a good option to rely on it solely. So you can't rely on one, but I go with the least expensive first, which are mold test plates. It is not, if it's positive, that is not enough to move or really dive in, but it's the least expensive. It's about $20 for the plate, and to get it analyzed, you need it analyzed by a lab to see what's there. The next thing you can do is called a dust test or an ERMI test. That's going to take different dust samples around your home and see kind of the history of the home, and to see if there's something, some mycotoxins that are there. You can get air sample testing, which again, please don't only go off air samples, but they are a great source of information, but they're not going to show you things that are not actively falling through the air in your home. So you will miss a lot. I have a lot of clients that have missed big mold exposure from just air samples. And then you need ideally an inspector. They will do most of those testing when you call them out. So they're going to have a visual inspection, which is very important. And you can learn a lot how to visually inspect yourself too. Right. So we do talk about those things in course I have. And then again, also, I would say they're going to take some control samples for air. So you're going to see what it's like in a safe space, and then in different levels of your home. And then they will do some surface dust testing. They'll probably do an ERMI to get a score for the health of your home. And then they might do some actual samples where they would take a culture if there's any visible mold growth. So again, you could start off with the test plates. That's going to be your first little, step into this. But really, when you're making big decisions that would require some sort of remediation, I would go with an inspector.
Okay, great. And then so that's the home, and then let's talk about body. So there's the two different ones that are kind of, I think you use these mostly, and a lot of good mold doctors are using these. So
Yes.
there's a mycotoxin urine test, if you can share a little bit about that. And then also I'd love for you to share, I know sometimes some doctors recommend doing a challenge with some glutathione and things like that, and kind of just your thoughts on that.
Sure. So yes, I love the urine mycotoxin test. There's a handful of companies that do it, about 3 or so. I love Vibrant Americas because they check for 29 toxins, different types of mycotoxins, where a few of the other ones they check for about 12. So you are getting quite a bit of a difference. And again, with testing, if you don't test, then you don't know if you have that one, right? So I often opt, if someone can, for a more comprehensive test. Then you have the ability, if you like, to do a challenge test, which is when you're going to utilize glutathione and possibly even using the sauna, things like that, to try to get a little bit more out into the urine. I often caution people to do it just because if you've never taken glutathione, you don't know if you're someone that could react. And so I usually just like people to see what's happening naturally on your own. When we do a retest, you are going to have often higher levels because you're going to be in the midst of a detox. And so that would be kind of similar to a challenge test. I haven't had anybody have zero mycotoxins whatsoever, right? So we all have some exposure at varying levels. But I mean, there's plenty of people that it's in the kind of safe zone. So it's not that they are not
Being
immune to
burdened by it.
them, but yeah, you still can get them.
Mm-hmm.
But I've actually only had maybe 2 people that I've ever seen a mycotoxin test that did not have any in the kind of like intermediate alert category. So it's very common, right? And then we have an organic acid test, which is great because that is one, it has 5 mold markers and they are different than what are on the other test. But your whole first page of that is going to also look at fungal overgrowth, bacterial overgrowth. So if you have SIBO or different types of pathogenic bacteria, and then it'll look at candida as well. So
great.
That's
and that's a blood test, right? The O test is urine. A blood test. Oh, urine also. Okay, great.
Yeah.
It makes it a lot easier than having to go to a lab and get your blood drawn and making sure that you're hydrated enough. Like I know for me, it's always hit or miss if I'm going to be able to get a blood draw on a certain day. So the urine tests make things a lot easier to manage and just do at home.
Exactly. Plus it's great. I have a lot of little pediatric clients, right? So urine test is not scary. It's easy. And then, there's, again, plenty of adults that don't like to give blood either. So
Yes.
compliance is much higher when it can be done at home.
Yes, absolutely. Awesome. And then, so how often do you recommend repeating these tests? So say, you've done some of these tests and you're going to work on a protocol, you're going to try to do the detox. When's a good time to kind of retest and kind of check in and see how you're doing?
The minimum I would say is 3 to 4 months. I usually wait 6 months just because of cost, right? So a lot of these tests, it's not that they're extremely expensive, but they are pricey, especially if one is used to using insurance, right? They're not covered by insurance generally, so it is an out-of-pocket cost. So I like to just be very mindful of testing and the cost, because I would rather someone put their funds into helping them get better, right? And the protocol. Yeah. But
Absolutely.
I love to test because then you can see progress.
Yep. Yeah. Make sure that what you're doing is the right
Mm-hmm.
kind of path and, what's working and what's not. So it's always good to
Yes.
kind of get a bird's eye of how things are going.
Yeah.
Awesome. So let's talk a little bit about genetics too. So I mentioned the HLA gene, which I think it's about
Yeah.
30% of the population has, that keeps you from detoxing mold. Can you share a little bit about that and what a treatment is like for people with the HLA gene versus someone else that doesn't have it, that's just trying to detox mold as well?
Sure. So it basically makes you potentially more susceptible, right? So to not detoxing as well. So I always talk to people too about the genetics, right? Is it's not always actively there and turned on, right? Which means it's affecting you, but it has the potential to. So if you have someone that knows they have that genetic marker, or if it's something we look at, I love to run genetics with clients because it can kind of help me see a possible issue, but it doesn't always mean that that's going to happen for them. So, for example, I don't have the genetic predisposition for that, but my mom did, and then my daughter didn't. And within our home, I still was the most affected by mold, right? Because of
Interesting.
other detox issues that I have. And then again, because I had it triggered or reactivated Lyme, right? So I had a lot more going
More
on.
going on.
But at the
Yeah.
same time, because my mom had the gene, when we got our ERMI test back, which is the dust test, it, our house was almost near the highest it can be. And
Wow.
because we had someone in our home with the gene, you basically need to look at this as more serious, right? So the people in the home that have the genetic markers could be potentially much more sick with mold. So again, that's still, you're going to need to look at someone overall, their constitution, their immune system, how do they handle these things? Because some people just fare much better within a home than someone else. And this is very common because a lot of times I work with a lot of families. It's unfortunately usually the dad and then maybe one child feels completely fine. And then you have a mom who's very ill and a child who's very ill. And especially a child, if they were born in that house, those are some of my sickest clients, right? So usually the mom was pregnant in mold, and then the baby their whole life has been in a home with mold, so their immune system is at a big disadvantage.
Absolutely. And so can you share a little bit about epigenetics too? So that's kind of a big topic that people are
Yeah.
talking about. So, it's hard for people. Sometimes people think they have a death sentence just because they have a certain gene or
Yeah.
they're going to get sick for sure. But it's not just because you have the gene doesn't mean it's going to turn on. So some of these environmental factors like mold
Mhm.
and Lyme are so commonly turning certain genes on. So can you share a
Yeah.
little bit about that? And have you seen patients be able to reverse conditions where, say, a gene turned on? Are they able to kind of reset that and turn that back off once they heal?
Sure. So I wish we had a test to see that. That would be very cool. But we have to go by symptoms, right? Kind of. So that's the thing. Yes. Epigenetics means above the genetic code. So basically, our genes don't change, but our expression of them does. So some people say our genes are almost like a string of Christmas tree lights, right? So you have the potential for the light to be on or off. And everything you do and what you think about, it all has the potential to make things be favorable or unfavorable. So you basically, some things they study a lot are yoga, meditation, exercise, even just positive mindset and thinking. And then of course the food we eat, supplements, those can all turn on the genes we want, and they can downregulate disease genes. But we also have genes, right, that when they are exposed to chemicals and toxins and a lot of negativity and things like that, those can turn on a disease gene, right? So we have so much control over this, but I do think it is still very important to get our genetics tested because we can see the possible pitfalls that we might have in the future. And then we can kind of hedge our bets against that and see where to focus. So
Yeah,
that's why I
support your
love,
body a little bit in those areas before something
yeah,
takes it out. Yeah. And what
exactly,
are some
because we do have those possibilities for sure. And it's at
yeah.
a greater possibility.
And what are some of these kind of like genes or pathways that you look at specifically in your practice that you're kind of trying to prevent or keep the body from going down this path?
Sure. So we will look at definitely, because I love to look at toxins, basically
Mhm.
different detox pathways. So you're going to look at kind of different things for methylation. A lot of it really is how we process toxins, but some of them are things about how if you need more or less of supplements, right? So sometimes there are some issues with glutathione, right? And you might need more than somebody else, or there's issues with vitamin D or zinc or a lot of, I mean, it's amazing what we can check, right? So what you can do then is just really help support your system and see, and then especially some really big ones have to do, of course, with metabolic pathways, right? How sensitive are we to sugar, maybe prone to getting type 2 diabetes? There are a bunch of people, of course, that are very worked up about Alzheimer's genes, right? So I do look at that, but the whole thing is what are you going to do with this information, and how are you going to take this information and basically shore up the potential issues, right? So it gives us a great amount of information, especially even with Alzheimer's. It's not as simple as one gene usually either, right? These things have a lot more complexity, and they're kind of being whittled down to a gene, which isn't entirely true, right? But
Yeah. It's multiple things
some,
going haywire at the same time
yeah,
and different things triggering it.
yeah, because let's just say even Alzheimer's, right? That has been implicated with mycotoxin exposure. It's been implicated with heavy metals, a lot of different things, right? Even blood sugar. And so you want to look at it from a lot of different angles. And then again, we can use that information though, and then especially pair it with functional blood or, these specific types of toxin testing, and then get a really good plan together for somebody, because you can see, is this already starting to happen, right? Functional blood looks at optimal ranges, so we catch things much earlier. So then you can kind of see, is someone down a path of potential issue, and how can we fix it?
Always like good to be more proactive and try to look for things before they actually happen, because it's a lot
Yeah.
easier to kind of like, heal your body when it's like not quite there yet versus once
Yes.
you've kind of gone down the dark path of these chronic conditions. So, and then so I want to shift gears a little bit. So we've talked a little bit about like whole body detox and especially
Mhm.
mycotoxins, but there's also this new concept of cellular detox,
Yeah.
and making sure that our cells are working correctly. So I'd love for you to share a little bit about that and what that looks like.
Sure. So it's one thing, right, for our cells to be basically kind of impaired by the toxins and things we're exposed to. And then it's also something we want to look at, are the mitochondria functioning well? How are we doing producing energy on the mitochondrial level? And then again, how fortified is your cell membrane, right? So the cell membrane is kind of like a castle wall. And if it is strong, it will keep things out. But we are often exposed to so many things that we still need to detox, right? It's kind of like the theory of some people talk about terrain, right, versus pathogen. And a lot of times it's not one or the other, it's still both, right? So we need a strong terrain, but we also need to make sure these very potent pathogens can't get in. So the cellular detox, basically, we're going to remove some of the toxins that are impacting the cells, creating a lot of cellular stress. And then we're going to fortify the membrane so that we can try to keep things healthy and keep things out that don't need to be in the cells.
Mm-hmm. And how do you do that exactly? Is it different supplements that you do? Is it once
Yeah.
you start kind of detoxing your body, do your heels start to cell, or do your cells start to heal on their own? Or what's kind of a protocol for cellular detox? You don't have to give the whole
I
protocol, but just kind of like a high level
yeah,
of how you treat
I
that.
so again, a lot of this has to do with the phospholipid bilayer.
Yep.
So we
Yep.
are going to use PC. So there are a couple of my favorite companies that do that. There's Quicksilver, Body Bio, and then the other one that I use a lot of, sorry, I'm just checking on my shelf because I've heard, is Prodrome. So
What's the
that
last
is
one?
made Prodrome.
Prodrone.
So
Okay.
that's made from egg yolk protein instead of
Mm.
soy.
Mm.
So it is more expensive and I believe better, but
Yeah.
it is, again, everyone is different and we customize things to the individual, but
Mm-hmm.
utilizing something that's really nourishing the cell membrane is very important.
Mm-hmm. So could you just eat a bunch of egg yolks every day and get the same effect?
Yeah, no, I wouldn't say, but I would say that having runny egg yolk is,
Uh-huh.
if you can tolerate eggs and egg
Yeah.
yolk, a really, really critical brain food and very critical for your cells, right? So I think that's something with Chinese medicine, right? We see animal products as medicinal. And so for the right person and in the right amounts, they are required.
Mm-hmm. Mm-hmm. Gotcha. And then, so let's go back to mold just for a second here. So, as part of like kind of a mold protocol that you put people on before you test them
Mhm.
again in 6 months, are you using some of this cellular detox and cellular health like in the beginning and the end, or kind of what stage do you use this at? And what's a kind of overall protocol that you would do for someone that has mycotoxins?
Sure. So we want to make sure right in the beginning that you are, going to the bathroom regularly. Because if you're not, if somebody's constipated, they should not be starting a cleanse, right? That is your number one goal, is to make sure that, you have proper elimination, right? You need to also support the liver, the gallbladder. And again, this can be through food, but generally supplements will help you do this faster, right? So there's also, everyone is quite different and very sensitive. So if you have someone very, very sensitive, you go very, very slow and you just use maybe one product at a time and then layer together a protocol. But definitely need the liver and gallbladder supported. And then again, if you have any sort of methylation issues, it's good to support with methylated B vitamins or whatever is right for your particular needs. And and then again, I do like using a PC, phosphatidylcholine of some sort to help the cells. And then again, you do look and see what's going on with the gut, but we also don't want to seal up a bunch of pathogens that could be there prematurely. So I often work on the gut a little later. And then after maybe a kind of a month of preparing, then we add in a binder depending on the person, what they need. That can be very gentle or it can be a little bit more aggressive. And depending on how many mycotoxins they have, they're often on that for quite a bit. But then we're going to start rotating, and then we're going to look at parasites and heavy metals, environmental toxins, and then if you have other viruses and Lyme and things like that.
Mm-hmm. Yeah,
So
because it's
that's
never
kind of
just
a
one. It's never just one thing, right? It's always like you're kind of peeling
no,
the onion. First, you've got the mycotoxins, then you might uncover
yeah,
high heavy metals and things like that are just kind of starting to come out that have all been kind of hiding together, if you will. So it's
yeah.
always more to the story, isn't it?
And minerals are really important too. Like
Mm-hmm.
I love doing a hair mineral test, seeing what's going on, and then again, making sure that you have enough of those minerals and just those core nutrients to detox. And, you need to be supported along the way.
Yeah, absolutely. And then, so once someone's kind of gone through a detox and they've gotten their body to a good state, and what's kind of a maintenance program like? Like you're always going to be exposed to
Mhm.
mycotoxins. Like even
Sure.
me, like when I go travel, I stay at a hotel, all of a sudden
Yeah.
I can just tell that I got exposed, and I'm like, oh God. Or you see the mold somewhere, and you're like, oh my gosh, how much is this going to set me back? So now I've gotten to the point where I like always take glutathione when I travel. I always take a
Mhm.
binder just to try to
Yeah.
support my body. But what does like a good maintenance plan look like to kind of minimize when you do have these exposures to mycotoxins?
Sure. So yeah, you said a couple of them that I love, of course, right? So glutathione, something for the liver or gallbladder. So that could be like a milk thistle, NAC, depending on what you're doing, artichoke. I have a lot of Chinese herbs that I love too for the liver, but there are a lot of things that you want to just kind of keep on hand. Like you said, I also love a magnesium because you need to make sure someone's regular sleeping and then their stress levels are down too. And then I do usually use some sort of a binder. Again, I rotate around if this is maintenance, right? So for some people, it could be more gentle, like a chlorella. It can be like a fulvic or humic base. It can be charcoal. There's Takasumi charcoal, which is very
Mm-hmm.
gentle.
Yeah, that one is very
Um,
gentle.
yeah, and again, I think both of us are very particular with the products we use, and you should be, right? Because a lot of them are contaminated, a lot have things you don't want, and you're taking a concentrated amount, right? So, and again, something that works for one person is not going to work for everybody. So, it's important to listen to your body and then not go overboard too. And then again, it is important though, because of the things we are exposed to all the time. I like to use some type of a binder, and especially for the glyphosate, right? So if you eat at restaurants in general, you're going to get some pesticides, right? So I think that that's a big one that accumulates a lot. And because so many neurological diseases are on the rise, pesticides often have an affinity for the brain and for neurological um, symptoms. And so we need
Mm-hmm.
to keep getting those out because we keep putting them back in.
Yeah, absolutely.
Yeah.
And then, so when someone kind of goes through their detox, how often do you recommend continuing to test? Like, is this something that they should test like once a year just to make sure that their toxin levels are
Yeah.
staying low, or make sure that there's not anything else to address? Or once you've kind of done your final test, you're like, hey, everything's at an acceptable level, I'm just going to stick with my kind of maintenance routine. What do you recommend when someone kind of gets to their finish line?
That's a very good question because a lot of people, I'm not sure your health is ever a finish line, right?
No, right. But like as far
Right.
as like the big detox, right?
Like
Like it's like you're always
yeah,
always going to be on some sort of maintenance, but do you need to kind of
yeah,
like have testing to make sure that your maintenance
sure.
is
I'd
working
say
or that you
once
haven't
a
been
year.
exposed again once a year? Yeah.
Yeah, once a year. But again, one thing I do love the hair tissue test because it's not as expensive, gives us a lot of information. And I think minerals are so important that it's checking your minerals. It's also seeing how you're using them, which can give you a really good idea of other issues in your system. And then, I mean, functional blood, I would do once a year is a minimum, maybe twice a year. You would really stay on track, right? With that. But again, it's not going to check for toxins. So, and it really would be on what you came in with, right? If you didn't have that many toxins and you're just trying to keep healthy and prevent, then yeah, functional, I would say once a year would be your minimum for everything.
Mm-hmm. Mm-hmm.
Yeah. But you could space it out so that you had a test every 6 months of some sort.
Yeah. Not have to do it all at once. You're
Yeah.
like,
Yeah.
yeah, absolutely.
Yeah.
Awesome. And then, so as far as like testing your home too, so once you say you've tested your home, you found a little bit of mold, you've remediated
Mm.
with a professional, is that
Yep.
something that you should also check your home once a year, or should you just test
Yes.
it if you're starting to have symptoms again?
So I would say it really depends. If you ever get a water leak, right, it only takes 48 hours for mold, 24 to
So
48 hours for mold to grow.
crazy.
Yeah. So we had a water leak at the new house where I had moved from a lot of mold in our old house. And I was thinking like, oh my goodness, there is no way there's not going to be mold. But we had them over really fast. They opened up everything and there wasn't mold, right? So it was able to get air dried out, which I thought was a miracle. But it can happen, but they're
Yeah.
really great things, right? Like Amazon has these little water leak detectors, right? So it will go off if you place them, which I do suggest kind of anywhere that there's water, just, have a plastic bin because then you basically prevent some bigger problems from happening.
Mm-hmm. Yep.
Um,
I have those all over
using
my house. Any water appliance has one. My cleaning people set them off like every week, and I'm like, when will you learn that these go off with water? Please stop doing this. But I was like, at least they work, so they get like a little
yeah,
test run every like week or two. But
yeah,
yeah, it's like especially when you're like traveling, or we have like bathrooms
yeah,
that we don't use a lot, or I don't
Mhm.
want that to turn into an issue or leak behind the wall or
Yeah.
have like a slow leak that's not getting picked up. So I have it like at my washing machine, all my sinks, everywhere.
Yeah.
Anything that has water has one.
Yeah, and kind of like that, prevention is huge, right? For that. So a big part of that for homes is just cleaning, right? So using microfiber cloth, there's different wipes that are great from EC3 or the uh, Benefact. So there's some different things that are just great to use. And I would say you might not need to get a full on, you know, home inspection unless you really needed it if you're on top of things. And that's one thing that I think is good and we include kind of in our course, or just some of these things of like how to prevent a mold incident, right, from occurring, because a lot of these things are prevention, and then just kind of how quickly you act on it. Most of the things are from something you didn't know about, right? Or maybe prior to when you had the home, and then you realize, oh, I have to investigate this because something in our home is making us sick.
Yeah. And I would like to add, like, not only just kind of taking care of the interior of your home too, but also the
Mhm.
exterior. So,
Yeah.
like, making sure your gutters are draining properly and not pooling anywhere, like, making sure your paint is sealed. So, we just had one of the rainiest winters, like, these past two
Mhm.
winters here in
Yeah.
California. And it was almost like I don't know, it's like I have this, like, premonition. I was like, we need to get the house painted. We need to get, like, new gutters because they were falling apart. So, we did all this stuff to kind of seal up the outside of our house,
Oh,
and it was awesome. Like the whole house stayed so dry. We didn't have any leaks or anything. And I saw so many neighbors putting like tarps over like places. And I was like, oh my God, I hope they're like addressing that because that's going to turn into a
mhm.
big serious issue. So making sure that you're maintaining the outside of your home is just as important as maintaining the inside and looking for those leaks as well, because that's where the water starts to get in, when it rains and you have wet weather and things like that. So super important as well.
It is. And it is very important. There's all these things that once you have a mold inspector at your home, if you do, I would follow them and ask them questions. I mean, don't be annoying,
Hmm.
but you know what I'm saying? You will learn so much
Yeah.
because they even would show me how, there was a big hill behind our house, which was not good because of how water will pool. Or, there's all these things that the trained eye knows very well, and it actually can
Yep.
help you quite a bit. And then
Yep.
if you see just these patches of wet earth, that's a sign that there's water that generally, is not supposed to be there. And so there are a lot of things that you could catch much earlier, should you be aware of that. And I think that that's important.
Yeah, absolutely. And then, so I want to switch gears a little bit. So you have an amazing 8-week course that you put together on
Yes.
mastering mold for people that kind of are on their own healing journey or wanting to heal from mold. I'd love for you to share a little bit about that and how people can access that as well.
Sure. So this is a course because not everybody can work with a practitioner, right? I know there's a lot of different reasons why. But again, we wanted to put together a lot of the education and again, a lot of myths about mold, right? Because you are going to be met with a lot of things that people dismiss or they say, oh, that can't make people sick. So we give you guys information, we give you articles, we give you some expert interviews from some of the people that we trust on the building side of this. Because again, I focus on getting it out of your body, but there's a whole other piece about the home, right? And it's a really important piece. So we want to give a lot of education. We have the protocols that we've used and then how to tweak them a bit, also for kids, sensitive clients, and then kind of traditional and then seasoned detoxers. But again, this is really for if you might even just suspect that mold could be part of your health history. Again, we have quiz you can take and see. But again, I think that mycotoxin exposure is the number one most overlooked root cause of symptoms for people that are chronic. And then again, also just things that people wouldn't associate with mold, we see. And I've looked at thousands of tests over the last, whatever it is, 5 or 6 years. And it's at least 98% of all the clients have mold exposure. And again, it's at least, that means at least 2 or 3 kinds in, the caution area.
That's
So,
crazy.
especially with
That's so
kids, I
high.
really
Yeah.
am, want to help people and help families
Hmm.
too.
Yeah, absolutely. Awesome. And this has been so helpful. Thank you so, so much for sharing all this information. And we're going to go ahead and link to the course as well in the show notes. If you're looking for that, we'll have that there. And if people want to reach out to you and book a session and learn more about your practice, how can they find you?
Sure. So my website is drashley.com. So drashley.com. There is a little link there. You can book a complimentary 20-minute call to see if I can help you or hear a little bit more about what's going on. And but yeah, and then we have the course masteringmold.com, and that is often a great first step.
Awesome. And we'll link to all of this as well. Thank you so much. This has been so great. I'm really hoping that this helps people on their mold journey, and hopefully we can all get better from this nasty stuff that's all around us.
Yes.
Amazing. Thank you so much.
Of course, always a pleasure.